Good afternoon, everyone. I'm Anne-Marie Schmidt. I'm the editor-in-chief of ATVB Journal, and we just concluded our ATVB Journal session here at Vascular Discovery 2026. And we are very tremendously pleased and honored to have heard from and awarded the Early Career Investigator Awards that you'll hear from two of the three, and also the second David A. Dichek Mid-Career Investigator Award for 2026. I would just like to mention that Dr. Liberale is a recipient of the Early Career Award. However, he was unable to be with us today. But I would like for the two awardees that are here to introduce themselves and then the Dichek awardee. And I'll begin with introducing Dr. Kathryn Howe.
Thank you very much. First of all, thank you to the ATVB for being such an amazing supporter for all of us in our early career. It's a place that I've gotten to know and feel the community every time I've been here, so thank you. My name is Kathryn Howe. I'm one of the vascular surgeon scientists at University Health Network and also attached to the University of Toronto in Canada. I've been honored with one of the Early Career Awards, and it's for the work that we do really focused on the endothelial cell. These are single cells that basically hold hands in a lineup throughout every single blood vessel in the body. And it's my honest belief that they are gatekeepers of health and disease. So one of the things we've been doing in the lab is trying to understand how these cells communicate, maybe in health and maybe in disease, to other cells that might then govern these processes. And some of the work that we've done has really been neat to really show that they basically release messages that instruct other cells how to behave. And some of the work that we've shown and we demonstrated today was really bringing that just from the lab environment into human tissue and understanding why this might be relevant for patients. As a vascular surgeon, one of my biggest frustrations, and it's also personal because we've had this in our family, is what causes stroke. So when patients have carotid disease, so disease of the blood vessel in the neck, related to plaques that have formed, unfortunately, some of those plaques will be fine for a lifetime, but some won't. And the question of which ones are going to be the lethal or at least the really harmful plaques really is the crux of what we're trying to understand in the lab. So by using some human tissue that thankfully we had kind patients that were willing to donate, we were able then to use this for information to get at that idea of how those cells, the endothelial cells, how they communicate and instruct other cells to then basically create what we think are these vulnerable plaques. We think we may have an early signature of risk that might help us now have a new therapeutic target. Without the ATVB support, we'd really not be making any of these advancements. And again, it's still a little ways away, but we're super excited by what we were able to share today. Thank you.
Thank you. Dr. Dai?
My name is Zhiyu Dai. I'm an associate professor at Washington University at St. Louis. So I want to thank you for the ATVB support for this Dr. Werner Risau's Early Career Award in Vascular Biology. So my research on this award manuscript is on the fatty acid binding protein form 5, which we identify from a patient with idiopathic pulmonary arterial hypertension. And we found from the patient with pulmonary arterial hypertension, the plasma level of the fatty acid binding protein 4 and 5 increased, and they correlate with the hemodynamic and right heart dysfunction. And later we were able to use genetic mouse model to demonstrate the elevated plasma level of the fatty acid binding protein 4 and 5 regulate endothelial cell dysfunction, which mediate multiple processes. For example, it can mediate the endothelial cell subtype transition, for example, from capillary to arterialization, and at the same time can promote endothelial cell glycolysis, so which can lead to the vascular remodeling. Our study found that if we are using genetic approach to reduce these two genes, fatty acid binding protein 4 and 5, we are able to normalize the pulmonary arterial hypertension and protect animal models died because of due to the right heart failure. So our study has been related to the human. So we believe that FBP 4 and 5 could be used as a biomarker for pulmonary hypertension patients. And there's also study shows that if we use fatty acid binding protein inhibitors, can inhibit the disease progression and potentially can be as a translational agent to reduce the disease progression and being a therapeutic target in the future. Thank you.
Thank you. So the third awardee that's with us here today is the recipient of the second annual David A. Dichek Mid-Career Investigator Award. And Dr. Dichek was a senior editor of ATVB Journal and passed away unexpectedly just a few years ago. And our editor team really strived to be able to identify a way to memorialize, remember David in the true sense of what his contributions were. He was an amazing and extremely prolific vascular biologist. But when you talk to people at the University of Washington, where David had spent many years of his career, one of the resounding themes was his role as an exemplary mentor, mentoring not just early career individuals, but mid-career. And one of the issues that is certainly the case, and it's kind of funny within the American heart, context, there are many awards for early career and many awards for senior career, and there were not quite as many for mid-career, right? So it seemed a perfect opportunity to ask the American Heart Association to help us to be able to memorialize and remember David with a mid-career investigator award. And this year, Dr. Courtney Grifฟี่from the Oklahoma Medical Research Foundation is the recipient of the award. And just very briefly, in addition to her amazing work in vascular biology, she can also tell you about her dedicated role as a mentor from students, postdocs, early career investigators. She really has led not only with hands-on approach as a mentor, but also at the institutional level to help to support training and mentorship. And I would like to introduce Dr. Courtney Grifฟี่as the recipient of this year's award for David Dichek, for her to tell us about her research, how it relates to people, and how she values mentorship. Courtney.
Thanks, Anne-Marie. Well, as I had a chance to mention in my lecture today, I was also very happy to actually know Dr. Dichek when he was alive. I actually met him when I was a grad student at UCSF. He was starting his first lab there. And well before I knew of his reputation as a mentor, which, continued to grow throughout his lifetime, I benefited from that caring personal touch. Whenever he would stop through my mentor's lab, he would take time to greet me and ask about my own research and just check in on how I was doing. And that was really meaningful. And I try to remember that when I interact with people at my own institution and throughout our field. And it just doesn't go, as I said today, to people at the first stage of their career. That's, of course, important. But we need to continue to give each other encouragement throughout our careers, at the mid-career stage, at senior career stage. As I mentioned today, this career can be a little bit rocky at times. We've all experience the ups and downs, and it takes a really genuine and empathetic touch from someone like David Dichek to remind us that we're all in this together. And so I hope to continue honoring his legacy and example as I interact with mentees. Interacting with mentees, by the way, has been a real privilege in this career, and it's something that I feel like I continue to need to strive to get better and better at. It's a lifelong learning experience to be a mentor and to be a more effective mentor. And the more people that I have a privilege to interact with, the more I learn about different styles that people are receptive to. We all learn in different ways. And it takes a real human touch, which David had, to be able to connect with people at a real level and understand what they're going through, and then help lift them through their career journey. So I'm grateful to be a recipient of this award. And the science that I talked about today actually goes back, and it started way back in my graduate lab when I had a chance to meet David back at UCSF. We were interested in that time in a family of receptors that are best studied on platelets as thrombin receptors. And so they're very important in platelet clotting and hemostasis and thrombosis. But even way back then, when I was in grad school, I was interested in what these receptors also do on endothelial cells. As Kathryn said, I'm a big fan of endothelial cells. I think they are the gatekeeper to health. And so with the benefit of decades of further training in endothelial cell biology, I got to a point where we finally had the right genetic tools to study these receptors in vivo and really understand what they're doing in endothelial cells. And using mouse models, I described two stories today, two short stories that we published in ATVB over the past year, showing both beneficial and detrimental effects of these receptors as they respond in different disease environments to proteases that activate them, most likely thrombin. And we showed in the case of acute thrombin generation that they can lead to a lot of vascular leakage and dysfunction. But in the case of chronic thrombin exposure, they can also potentially make insulin signaling a little bit less sensitive. And so in that case, they're really not playing a great role. And it might be beneficial as we think about diabetes to perhaps suppress some of that dampening signal that these receptors mediate on endothelial cells and see if we can make the body more sensitive to insulin.
Okay, thank you. Okay, and now we'd like to hear from Dr. Liberale, and he is also going to tell us a bit about his research, particularly the research published in ATVB that was the basis for his award, and also to tell us how that relates to humans, how his findings can be relevant for patients suffering from the diseases that he is studying.
So in this paper, we asked whether the direct inhibition of IL-6 exerts antithrombotic effects, and if so, through which mechanisms. Using a murine model of chronic low-grade inflammation, we found that blocking IL-6 with a monoclonal antibody significantly delayed arterial thrombus formation. This effect was not mediated through the coagulation cascade, but rather through a selective reduction in platelet activations in response to collagen. And of course, collagen is the key trigger of thrombosis after atherosclerotic plaque erosion in humans. We confirmed this finding ex vivo in patients with very high cardiovascular risk, where ziltivekimab reduced collagen-induced platelet reactivity even on top of dual antiplatelet therapy. And the underlying mechanisms involved a crosstalk between the IL-6 signaling adapter GP130 and the collagen receptor GP6 in platelet membrane. Of course, this research, we hope, has direct implication for cardiovascular prevention. Ziltivekimab is currently being tested in the large phase 3 Zhiyu trial in patients with chronic kidney disease, atherosclerotic cardiovascular disease, and systemic inflammation. Of course, a population with very high residual thrombotic risk despite the standard therapy. And our findings provide a mechanistic rationale for why ziltivekimab may reduce these hard cardiovascular events and beyond its known anti-inflammatory effects. For us, most importantly, we demonstrated an antithrombotic effect on top of dual antiplatelet therapy, suggesting that IL-6 inhibition could become a complementary strategy for patients who need additional thrombotic protection, but cannot safely intensify the antiplatelet treatment due to the bleeding risk, for example.
I also wanted to ask you all, just briefly, tell us about what's next. What excites you as your next steps in science? So, Dr. Dai?
Yeah, that's a very interesting question. So currently, I think my goal in the future study, one is that to figure out the fundamental mechanism about how the disease, pulmonary arterial hypertension, was developed and progress. So one of the points we are very interested in is the lung and the sort of heterogeneity, which right now we have utilized the human lung aspirant tissue to understand how the different subtype of lung endothelial cell contribute to disease initiation and progression. So hopefully in the next few years we have new discovery. The second part of my goal or the interesting right now is that to do the translational work to translate the finding we are doing to potentially clinical. So we identify transcription factor called hypoxia-induced factor 2 alpha, which have FDA-approved drug. So right now, we try to do the repurposing of the HIF2 alpha inhibitor called like Werner, which has been approved in renal cancer patients. So right now, we are performing the study to try to make a new formulation to perform the intratracheal nebulizations in the preclinical model like a mouse and rat. So our goal is that we will potentially translate this finding on human. So at the same time, we also collaborate with our clinical doctor, Dr. Marali Chakanani, to see whether we can initiate a patient trial in our institution. We hope our finding will be potentially lead to patient treatment in the future.
Thank you. And Kathryn?
I think the common thread is we're all in love with the endothelium. So these cells really are gatekeepers. And one of the things we talked about it because of the ATVB and invited lecturers that are really gods in the field, if you will, is really the understanding that maybe we should be understanding resilience. What makes the endothelial cell stay strong and healthy and able to defend and maybe be able to recover, maybe halt or slow down some of the aging processes that take place in the human body. And so we do ask these questions in the lab, thinking about endothelial resilience and what might be helping them maintain all their positive things that they do to maintain health. And that's in the arm where actually I think aligns nicely with the beautiful award that I had from Daniel Steinberg, which is that idea of prevention. How do we start thinking long ahead of what the disease actually already is, where most of us tend to treat patients today, and we start moving into what the HA guidelines have done just this year to really start talking about being proactive. And so that is one arm of what we're trying to do. In the meantime, when there is established disease, we're really trying to understand, is there a way to get focal therapies in? Is there a way that maybe we can take some of these insights from this paper to really deliver something into the plaques and make them stable? And hopefully, ideally, we find just the right group of patients. And there's maybe some new news coming out where maybe we found a small population that had that signature risk that let us better identify them. So I'm excited, at least for the future of where we're all headed.
That's wonderful. It's so exciting. Thank you. And Courtney?
Yeah. So
What's next?
I'll follow on with Kathryn's resilience theme too, because what I've really been fascinated in for the past few years is what keeps endothelial cells and small capillaries alive. And that's a really interesting question because in a lot of diseases, we actually get death and loss of capillaries. And this can be called capillary regression or dropout or rarefaction. There's different names for it. And curiously, although the vascular community has studied angiogenesis and how to promote and block vessel growth for decades, thanks to Dr. Folkman's work, we really haven't put as much attention into capillary regression. And I think it's a very different process from vessel growth or blocking vessel growth. And my lab's been working really hard to identify clues because we think that there's probably some pretty consistent themes or recipes that lead to this process in different organs throughout the body. So we've been focusing a lot in the eye and in the kidney, and we're starting to focus in the heart, 3 organs where we know capillary dropout can lead to disease. In the eye, especially, this leads to retinopathies, which are this overgrowth, which when you lose capillaries leads to an overgrowth of unwanted pathological vessels. And by learning how to push and pull on the capillary regression process, we're coming very close to some commercialization efforts and clinical trials at being able to stop the progression of these retinopathies, especially in diabetic patients, and hopefully preserve vision. And we're looking to take those findings and, like I said, apply them to other organs. I do think that thrombin and inflammatory cytokines, which we've heard so much about at this meeting, are big mediators of capillary dropout. And so I think that's going to be something interesting to weave in with all the other science that we're learning at Vascular Discovery this year.
And then finally, Dr. Liberale will tell us what excites him, what's next in his research, and we look forward to hearing his insights into how he sees moving from his present work into the very next steps. Thank you, Dr. Liberale.
What excites me most in the coming years is understanding whether the collagen IL-6 crosstalk that we helped in identifying platelets is modifiable in a broader clinical context, and whether these direct IL-6 inhibitions can be integrated into a personalized antithrombotic strategy. We're also actively working on the intersection between aging, inflammation, and thrombosis, and particularly how age modifies the inflammatory drivers of cardiovascular risk. And I think the results of the Zhiyu trial will be a key moment for the field, and I hope our mechanistic work contribute to interpreting and building on those findings. Thank you very much again for this recognition, which means a lot for me.
And I think that just hearing from these wonderful early and mid-career investigators, you start to hear themes that was mentioned, by Kathryn about resilience. And there are so many diseases that affect people in which it is very clear that endothelial resilience, is really very suppressed, mitigated. And one of them, as Courtney just mentioned, of course, is diabetes. And that, of course, is the focus of my life's work. But it's just so wonderful to hear how the new work that has been described here, and also, of course, Dr. Dai is in a very serious condition for humans, pulmonary hypertension, really has a lot of common factors and also the distinctive factors that truly present the challenge to us as scientists with respect to finding and probing where each disease milieu fits, what are the best targets, and how can we attack them and do good things for people. In closing, I think it's very important that we are very, very grateful not only to the work of these investigators, but truly to the American Heart Association, to ATVB Council, for providing us not only the wonderful opportunity to lead and publish in the ATVB Journal of the American Heart Association, but very importantly to honor the dedication, strong motivation of wonderful early mid-career investigators that you've heard from today. So truly, from all of us, many thanks to the American Heart Association for the opportunity to do the research, to tell you about the research, and to help to mentor the next generation of fabulous scientists to take the lead. Thank you very much.